I'd like to talk about 25 warning signs of Lyme disease. This is part of a Common Sense Lyme series. I'm Dr. Cameron. I discuss cases and questions that come up in my practice, but I thought it rather interesting to talk about a lot of common symptoms that patients have that they're not always aware of the importance, they're not aware that they might be connected. So I thought I'd put together a common list, but it's not a complete list. So let's begin. Now, why it matters is that Lyme disease can strike without warning. People can be sick for a while, have symptoms for a while, but when it hits, it hits. So there can be quite a flare up. Also, people who have done well will sometimes flare up. So it's important to recognize these symptoms. Now, the warning signs often include mood shifts, mood changes. It can be almost any mood you can think of: irritability, sadness, euphoria, just detachment, depersonalization. There are even people who are rather anxious. Sometimes they can even have violence issues, suicidal issues. So there's a whole range. They come on like in waves. They can be confused with psychiatric problems. Fatigue and sleep problems is people tend to be wired. They tend not to be able to sleep very well, or they wake up early. They wake up rather exhausted. There's a number of digestive problems like bloating, nausea. The autonomic nervous system seems to affect the stomach, so you can get constipation, diarrhea. It can look like irritable bowel. The sensory overload is people tend to be very sensitive to light, sound, sometimes smell, heat and cold. Sometimes the sensory system is up so that they have elevated response to pain. They might be seen as centralized pain syndrome, and with those types of things, it seems to be related to the hyperactive immune response. Vision and head pressure. A lot of people have Lyme where they have pressure in the head that mimics sinusitis, and they can have headaches, but sinusitis is more likely the kind of symptoms one would have. You can have blurry vision, floaters. The floaters might be always there, you just notice them more. Pressure behind the eyes. I've had people who have kind of a distorted vision. It's not near, it's not far, but it's distorted. You can have a balance and dizziness issues. This is related to autonomic nervous system. POTS is the best example of postural orthostatic tachycardia syndrome. Air hunger. This is where you just can't catch your breath. It's not from exertion, not from walking, but this is sometimes seen in babesia, which is a tick-borne illness. Now, air hunger is, of course, hard to quantify because it's not measurable by a pulmonary function test. It's not really an official diagnosis. It's just commonly observed in babesia patients. Night sweats, if you have menopause, it's easy to say, well, that must be menopause, except they occur particularly in babesia. You can have sweats other times, but night sweats are particularly dramatic, and you might have to change your bedclothes. Now, half of babesia patients have sweats, but half don't, so it's not a single symptom. Brain fog, there's processing issues, there's focus problems. Sometimes people can have memory losses, they can have trouble driving. An internal vibration, restless kind of feeling can occur. This may be related to the overall sensory system being elevated. It could be the tired, wired problem that you see with Lyme. It could also be the cytokines that are increasing the awareness of issues. I've had patients where the old pain, like old injuries, old surgical procedures, where the pain is increased, yet there's nothing wrong by an orthopedic evaluation. It seems like the pain might be accentuated, and once the pain starts, sometimes you'll get spasm, particularly in the back, where you start getting in back conditions like mid back or neck pain. Heart palpitation is kind of related to the autonomic nervous system, where the immune system is responding to this positional changes, lightheadedness, and so it's a important. It also is important for your first week because some people get heart block, where they might have to go to the hospital and get evaluated for heart block. Tingling and numbness. This can occur like hands, feet. Sometimes they can have something called small fiber neuropathy. Uh, This is something that can often get better with treatment, but the small fiber neuropathy may be rather difficult to treat, and you may have to have other treatment modalities. Emotional detachment is kind of related to the overactive neurotransmitters that affect mood, but sometimes they can be disengaged, and sometimes you might think you have schizophrenia, but they can often have emotional detachment. Sensitivity to touch is something that's part of that overall response to the sensory system. The throat can be tight. There can be issues that really aren't so clear cut in the throat. The It's not really so clear that that's a specific finding for Lyme, but it can occur. Food reaction. People can be sensitive to foods that they would not be sensitive before. Sometimes it seems to be related to a histamine driven food reaction. This is different than a red meat allergy. Visual snow. There's flickers, static. That's part of that distorted vision that people get. This is something when they look at a TV, you look at something close. Sometimes it's distorted, sometimes it's tracking, and it's not really clear what it means because they go to the ophthalmologist and they can't find anything at this point with what we know about eye findings. Panic without trigger. This fight or flight situation where the immune system just doesn't stop. It's constantly in a cytokine type storm, or at least something that you can't put your finger on. It does create a fear. Sometimes when I talked about that someone has air hunger, not long after that they get anxious, which makes some sense. Word finding, like mid sentences, you just can't connect dots, or you might have to do three things in a row, and you have to pay attention to it rather than just automatically do things. It also affects driving. Clumsiness, dropping objects, missteps, fine motor changes. So you might be thinking of ALS and MS and some of those things, but the processing that you need to do those more complex tasks can be off. Then there's a startle reflex. They jump at small sounds, jump and have movement issues. This might be part of the fight or flight response that you see in Lyme. Being wired but tired. This overstimulation messes up the sleep, but also messes up being awake, where you can't really put your finger on it other than that you have both of those sensations. So what can you do? You should talk to a provider. Now, this is part of a Common Sense Lyme series. These are just a few of the common symptoms that one might experience. They should lead to an evaluation for a number of conditions, but I'm encouraging people to at least look at Lyme disease as a cause of these symptoms. Often these symptoms are waxing and waning. It can be rather severe. You can have a period that's rotten and then extra rotten and particularly rotten and go back and forth. And so months can pass before one puts a finger on these symptoms. And lastly, because these symptoms can be rather intense, there are a number of doctors to see given the complexities of the case. Thank you for joining me, and have a good day.